Welcome to 10-5, the official podcast of the OPP Association. I'm Scott Mills.
And I'm Emily Brown, and we are the Strategic Communications Coordinators for the OPP Association, and your host for 10-5, the official podcast of the OPP Association. Some background for our new listeners: the OPPA is the sole bargaining agent for the close to 10,000 members of the Ontario Provincial Police in Canada. Our members are our focus and our strength, and we aim to provide important information to our members and the public about matters that affect policing in the province of Ontario.
Well, thanks, Emily. Today we welcome OPP Provincial Constable James Giovannetti, also known as Gio, from the Dufferin County Detachment, and we will be talking about James's role as a mobile crisis response team member. And welcome, James.
Thanks for having me, Scott and Emily. It's nice to be here.
Welcome to you. Can you give us a little bit of background on your career to get started?
Yeah, so I started with the Orangeville Police Service in 2005. And while working for Orangeville, I worked in uniform as well as investigations. And then in 2020, we amalgamated with the OPP. And then in 2021, the Shelburne Police Service also amalgamated. So in Dufferin County, we went from having 3 police services that were servicing the area down to having one singular police service. So it was quite the integration for the residents in the community.
I imagine that was an integration for all the officers and all the support staff too. How's it going? Is it smoothed out? Is everybody used to the OPP there now, James?
It has been a great transition. As with any sort of change, we have struggles along the way. But I think now that the transition has happened and we've had that stability for a while, people are really seeing the benefits of coming to the much larger organization. So it's been a very positive thing for the majority of members.
Well, it's good. It's good to hear. And we're going to discuss a very unique role that you've had in the past few years as a sworn member of the OPP, working on a mobile crisis response team, and that's often referred to kind of in the first responder world as MCRT. Sometimes, I've got a background in Toronto Police, they call it MCIT, Mobile Crisis Intervention Team, but we're talking about MCRT here. And Gio, we've seen a lot of media announcements of late for further funding for programs like this for the Ontario government and places like Lambton County, Thunder Bay, Simcoe County. I know some of those are not quite the same as yours, and we're going to get into that as we go on. But I think this one quote that came back in a news release from the Ontario government, March 11th, 2022, when the announcement was made for your program in Shelburne, Ontario, OPP Commissioner Thomas Carrique said, and I quote, "Since 2017, the OPP has observed a 42% increase in mental health related calls for service. Responding to 911 calls in tandem means that police and crisis workers can ensure everyone is safe while also providing necessary mental health support to the individual in crisis." And the OPP commissioner went on to say, "On behalf of the OPP, I want to thank the Solicitor General and the Government of Ontario for this important and necessary investment in community safety and well-being." And I think it's a very good transition into what you have done, James, because my understanding is you were very instrumental in starting up the Dufferin OPP mobile crisis response team. And I was just wondering if you could give us some background on how this all started in 2022.
Thanks, Scott. So like I said, in the beginning of 2021, all 3 services within Dufferin County amalgamated. And as part of that transition, we were sitting there trying to figure out the best model to serve Dufferin County. Because having such, I'm going to say, a small geographic area with 3 police services that were providing service to the residents, that was 3 different sets of policies, 3 different programs. And it was a matter of trying to integrate, the best of all of those services into something that would work. So starting in 2021, we started to evaluate different options and looking at what would really service our community the best. Being part of Central West region when it comes to ministry funding meant that we were also getting the same pot of funds on the healthcare side as Peel. So when we look at the demographics, the majority of residents in Dufferin Peel live down in Peel. So Dufferin was getting a much smaller piece of that funding pie. And that created a challenge for us when it came to trying to find viable partnerships, because it became quite clear that we needed a program here in Dufferin that would provide not only on-site, social worker or nurse coverage with police at the scene, but we also needed someone that could be inside the detachment with us, that could ride with us to these calls and also be able to serve the lifespan. And that's presented a unique challenge because of the differences in terms of funding when it comes to children and youth mental health and adult mental health. So in kind of doing a scan of what neighboring detachments as well as police services were doing, we were able to connect with Headwaters Hospital, who was quite interested in forming a partnership with us. But again, funding becomes a bit of a challenge in these circumstances. And what we were able to do was write to the MCRT enhancement grant. And what we did was secure funding for 2 nurses from Headwaters Hospital, one full-time, one part-time. And then the funding for my position specifically was paid for from the Community Safety and Wellbeing grant that was put out. So in 2022, we were able to start that formalized partnership with Headwaters Hospital, where we were able to have nurses that are specially trained in psychiatry and addictions inside the detachment with us. And in addition to myself, I had 4 part-time constables that would cover off days where I wasn't working. So we had funding for 56 hours a week of nurse coverage, and that is frontline responding to calls in the moment, as well as doing follow-ups. So we would be getting referrals from officers who have attended calls saying, I think there's something going on here. Perhaps it's worthwhile to follow up and do a proactive reach out, because very often it is easy for us to look at trends and predict what's going to happen next. So if we can interrupt the escalation in that person's mental health crisis, we can often divert them from hospital. And that's basically been the strength of our program. And, we've had a lot of great success with it. And we went truly from a program that, many in the community as well as, within the detachment were saying, oh, is this the right thing for Dufferin? And we now have solidified great partnerships with, CMHA, Dufferin Child and Family Services, the Community Paramedicine Program, hospital, family health team, services and housing in the province, Punjabi Community Health Services. We really came in and, worked hard as a team to build all of these relationships. And we now find that we're getting proactive calls from other service agencies that are saying, hey, I have this going on with a client. Could you come by with us? Because they've now learned that with the expertise that our nurses bring on site, they are able to better service their clients, prevent the crisis, prevent more burden to the hospital and the healthcare system.
That's great background for people that aren't aware. The Police Association of Ontario has an annual recognition campaign called the Police Hero Awards that some people may have seen on their social feeds lately, where members of the public, they nominate police members, both active and civilian, for their service. And I wanted to take a moment to read your nomination for 2024 and get you to comment on the feedback. Provincial Constable James Giovannetti started the Mobile Crisis Response Team in Dufferin OPP. He went above and beyond, working many extra hours on and off the clock to ensure the program runs smoothly. He formed caring relationships with members of our community and a great rapport with many. As one gentleman reached his final days, James worked to locate his children, facilitated phone calls with loved ones, and frequently visited to lift his spirits. His MCRT team is making a big difference connecting our vulnerable population with help. James and his program take a load off the road officers. He takes time to listen, empathize, and find help for those who are struggling. He volunteers as a peer supporter and checks in on fellow officers after a difficult day or call. His nurse partner, Angela, is kind and caring and a huge asset to the team.
Well, when Scott reached out to me to let me know about that nomination, it was very humbling. It's not something that we get into in this line of work, expecting any recognition. But what I can say is that I worked with a fantastic team of people. Angela is our part-time nurse. She comes to us with a wealth of experience from the Waypoint Center. So she has just vast amounts of knowledge when it comes to the forensic system, psychiatry, addictions. It's a huge asset to us. And our full-time nurse is Michelle, and she comes to us from the community side of mental health nursing, where she had worked with some community providers doing community types of mental health follow-ups, community care. So both of them, there's been a number of incidents where we have been able to connect with people's psychiatrists, for example, when they're in crisis. And because our nurses have the ability to access their medical charts through the hospital, and they do it remotely, right? Because they're given a tablet. So they're actually able to connect with their primary care providers, and they can assist with medication adjustments and dosing and things like that. So it's just been an amazing experience for these people that are experiencing crisis or struggles, because they're not having to drive down to Toronto or Brampton to get that kind of on-site medical assistance that, frankly, certain models are not able to provide. Because if you don't have that registered nurse accreditation, you're not able to do the medication dispensing, for example. This specific example that has been provided is probably one of the most impactful interactions or relationships I've ever built with a community member. This gentleman was, I think, what a lot of us in the first responder world would consider to be a difficult client to work with. And it came to a point where our team was the only set of first responders that this gentleman would deal with. If something was going on and he couldn't regulate, he couldn't handle what was happening. We got the call to come there. We were the ones that were able to talk with him. And I can say that, through his last days, I visited him each day at the hospital. And it was so nice to see that he was able to reconnect with family members that he had been estranged from for 15 years. So he got to go in peace, and his children especially and his siblings were able to have, some good memories with him. Although it was at the end, they finally got to spend that time with each other. So it was definitely one of those situations that I'll never forget.
Good work, James. I'm glad you're sharing that story with us. We need to hear more of these stories, because we know that many of our members are out there going the extra mile, and it seems on the media all you hear is something bad or negative about the police. So kudos to you for such exemplary work. And I know when we were trying to prepare for this, I asked you, what are your key messages? And you've explained the community partnership, but you also said, stigma reduction, holistic approaches to situations. I think we've kind of covered that. Interacting with respect and treating clients like you would want your family treated. And I was just wondering if you could maybe elaborate on some of the stigma reduction, especially when you and Michelle and Angela are kind of working together, and you've truly made a difference for someone in the community.
Well, I think stigma reduction really looks different depending on the set of lenses that you're looking through in any of these types of calls for service. So, at the beginning, self-stigma, I think, is probably the most powerful source of stigma. And if we are stigmatizing ourselves, we are more likely to stigmatize others. Having policed for close to 20 years, the one thing that I've learned is that stigma is something, unfortunately, that is very rampant within the first responder world. And it is something that I've seen change over time. And I've recognized that when we start being kinder to ourselves, we start being kinder to others. And when we are able to go to these calls, we're able to say to these people, hey, you know what? I get it. I've been there. And I think it's important in certain circumstances to share that vulnerability with a person that is in crisis, because I can say from my own PTSD journey, I felt so alone for so long, and that nobody would understand what it was that I was experiencing. So I just shut my mouth. And once I started realizing that, hey, I'm not alone, it made recovery so much easier. And very often we are seeing these people at some of the worst days of their life, where they feel the most alone. So if we're able to go in and say, hey, I get it, I've been there, it can take someone from such a heightened and aggressive attitude or heightened aggressive place to a place where they're actually able to be receptive to some of the things that are being said.
So obviously, being a crisis response team, these kind of situations don't take a holiday. They don't know when it's the weekend. So I'm curious if you can share with us what your hours look like and how time off works and what a typical shift would look like for you.
That's a really good question. What we have going on in Dufferin right now is very different than what other teams may have in the province. And there's a host of reasons. One of them is we look at the trends. So we're looking at what the data tells us in terms of what are the days of the week that we're getting the most calls? What are the time of day we're getting the most calls? We also have to consider the working hours of our partners as well, because some of them are governed by collective agreements where they have to be working between certain hours of the day. We also have to look at the funding limitations as well and the staffing availability. So when we are looking at hours of service, we're funded right now for 56 nurse hours of coverage within Dufferin. And I know that there is a desire for us to increase that number. What we're dealing with right now, though, is trying to secure that funding in order to do that. Because as it stands, we are still mostly funded through grants rather than base coverage from the hospital. So that makes it very difficult for the hospital to be able to provide us the number of hours they would like to. Because I can say that our partnership with Headwaters is very, very strong, and there's a strong desire to continue to build the program on their end because of the efficiencies that it has created for them.
It's a perfect segue into kind of what we opened up a little bit earlier about, and we said that there has been kind of funding announcements in the news and stuff like that for, say, Thunder Bay and for Lambton County and for Simcoe County. And we had a bit of a discussion before we started recording here about there's differences in the programs and how they're delivered. And I was wondering if maybe you could touch on that a little bit, Gio.
Yeah, so there's a myriad of different crisis team formations within Ontario. There are some that are run down in Peel where they will have 2 civilian crisis workers attend calls for service that have been deemed low risk through dispatch in Peel. There are teams where we'll have a nurse and police officer, or teams where we'll have a crisis worker, social worker, occupational therapist, and police officer. And I think to some degree I'm a little bit biased with this one because I truly think that having a nurse-police combination is very effective because on one hand we have, the nurse who is the medical professional who oftentimes is able to determine that this isn't actually a mental health crisis, it's a physical health crisis. And it turns out in some of these circumstances that people have an acute infection. People's medication is reacting with them. And you have the police officer there in the majority of those teams to provide safety. The announcement, from my understanding after having read it, is in regards to a pilot program to partner community paramedicine and mental health professionals together to go out on scene to try and help persons that are in crisis. And I think it's a great idea because many, many times there can be a person who's in crisis where there's no organic mental health condition or personality disorder that's at play. It's a situational crisis. And I think there's a lot of value into having programs like that. I just don't know enough about how they classify what qualifies for that program and what would qualify for a police partnership kind of call.
Yeah, that seems to be the debate that's out there. What do you? I'm going to throw this out there. Does having a police car show up? Are you in a marked car? Does that stigmatize the person because the call is in relation to? I've heard a lot of these different arguments. I personally believe that the police and nurse combo works as well, because I've seen it work personally. What are your thoughts on that? Like, where do you, I guess the question is, what is your outlook for mobile crisis response teams, kind of on a larger scale, and what's your outlook for your personal career moving forward with it?
Well, I think when it comes to police response to persons in crisis, the less attention that we are bringing to that person, the better. And one of the big things that I've been a proponent of with our team and our previous detachment commander and present detachment commander are supportive of is the use of an unmarked police vehicle. And the reason for that, obviously, is when we are responding to a person in crisis, they don't want the entire neighborhood to be looking in front of their house and seeing a police car there. Yes, most of us are able to recognize a police vehicle, but that's also because we're looking and we recognize the telltale signs. When we're walking up to a door and, someone sees a police officer, but right beside them, they're seeing a nurse with nurse plastered on the front of their vest. It's so effective at de-escalating a person who's heightened, because they're immediately seeing that it's not just the police that are coming here. There's a nurse too. And I think as a society, we view nurses as the caretakers, the helpers, the people that are here for me, to help me. So for these people that are in an acute state of crisis, very often that can be the game changer. I think that as time goes on, personally, I think we're going to be seeing a lot more police nurse, police social worker combos out there on the streets, because there are so many calls that we deal with that aren't necessarily law and order related. They're more of a social issue. And I can say that in 2023, for example, I think that our MCRT team put out 750 or 770 referrals to community programs, to social agencies, to try and get these folks that were struggling connected to community-based services. Because hospital is not the solution for all people. And frankly, for many people, hospital can be a more traumatic event. So by reducing the number of hospital attendances, we are finding more successful outcomes for those people out in community. As for myself, we'll see what happens. I was very lucky to have had an extension once already with the team. And I'm very proud to say that I've passed the torch on to one of the then part-time officers who has now taken over MCRT. And I'm still active on the team as one of our part-time and backup officers. And I also, get involved in helping on the back end with the grant writing or some of the community partnerships and things like that.
Now, often here, you may have heard this in the past on the 10-5 podcast, we like to ask our guests for their 3 wishes for change. Thousands and thousands of downloads, and you never know who's listening. So can you share with us your 3 wishes for change?
Well, I think the first wish is more funding. And when I say funding, I mean for the hospital system, for our community-based social networks, social supports like CMHA, Service and Housing in the Province, Punjabi Community Health Services. Like, all of these agencies provide such vital assistance for the community, but the money isn't there. And I look at our partners at Child and Youth Mental Health at DCAFs, and they have phenomenal staff there that are working with these kids that need help. But, they have wait lists. And for a youth especially that is experiencing a crisis or mental health struggles, quick access to ongoing care is so important. I would say more understanding, and that does go along with stigma, but I think that the majority of people really don't get it. And that's not a fault in any way, but they just haven't experienced what a lot of people in crisis are experiencing in that moment. And if we're able to, interact with these people in a way that, is compassionate, it's respectful, and it's non-judgmental, we are able to help them so much just by interacting in that way. I guess my third wish would be that as a culture, as a society, we would change, and that in everything that we do, we are leading with kindness. Because simple acts of kindness can make the difference between whether or not someone decides to take their life that day or if they choose not to.
I think you've summed it up brilliantly, Gio. It's pretty simple, yet it seems so complicated sometimes. But I just want to take the time here to thank you and your team, to Michelle and Angela and all the other people that are involved. You said there's a lot of backup officers. You're one of those backup officers now. Also, thanks to the families of these people, because you deal with things that, you mentioned PTSD before. You deal with situations that they're hard to get out of your mind. And just know that your service is appreciated and needed and valued. And we're grateful for it.
Thank you so much. I really appreciate those kind words.
And if you can convince Michelle or Angela or somebody to come on our podcast here and talk from the nurse perspective, I think that'd be a great follow-up if you're willing to advocate that it was a good experience.
Yeah, absolutely. I will talk with Michelle and Angela, and I'll encourage them to partake, and I'm sure they will. They're both very, very passionate about their work, and I can't say enough good things about the two of them. The amount of time and effort that they put into the program, and it's not just for providing the supports to the community, but they've also become trusted members within our detachment. So, very often we will have those frontline members and support staff coming and meeting privately with the nurses to discuss, struggles either they're having or family members are having. And that's one big piece of MCRT that I think is overlooked a lot, is the overall impact in a positive way on member wellness. And I can't say enough good things about them.
As we come to the end of this podcast, do you have any final thoughts you'd like to leave with?
I think that as an organization, OPP is on the right track. I think that over the past 5 years especially, the amount of resources that have been put towards, the well-being of not only community but as well as members has been phenomenal. And I'm really looking forward to seeing the impact in both community and our membership as time goes on, and the initiatives continue to expand.
Thank you so much for taking the time to speak with us. We really appreciate that, and all the best in everything that you do.
Thanks again for the opportunity, and same to you.
You have been listening to Dufferin County OPP Provincial Constable James Giovannetti talking about his OPP Mobile Crisis Response Team, where a nurse and a specially trained police officer are paired together to respond to mental health crisis calls. If you like what you hear, please hit the subscribe button on the podcasting platform you regularly listen to so that you never miss an episode. For Scott and myself, thank you for listening. And if you have any ideas, topics, or guests for future episodes, please email us here at communications@oppa.ca. Until next time, stay safe.